Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. Thank you so much for coming on. I was actually fascinated by your new company, and I see that explosion. First of all, can you introduce yourself?
Yes, my name's Jeff Richards. I'm the Chief Operating Officer and co-founder of SnapNurse. We are a tech-enabled nurse staffing company here in Atlanta, founded in 2017 by my partner, who's really the original founder, Cherie Kloss. We both went to school together 20-something years ago here at Emory University in the anesthesia program, and kind of went our separate ways after school, where I went on to work in anesthesia and then become the director of anesthesia at Grady Hospital here in Atlanta. So training residents, managing trauma, and then in the director role, of course, doing administration, budgets, hiring staff, interfacing with staffing agencies, which is part of the genesis of our idea and the arc of our company. While my partner and our CEO, Cherie, went her separate ways, was working as a contract anesthetist, did have a stint as a producer for reality show television, and then reached out to me 19 years after we went to school together and said, would you like to help me on my startup? And at the time, I was working as the director of anesthesia at Grady Hospital and had been experimenting with an app inside of my own department called Crew, getting my staff notified by phone using the app when they needed to replenish anesthesia supplies, and just tracking efficiency and fascinated by the adoption of technology within the hospital. And I was also in MBA school, and I wrote a paper on a mobile healthcare staffing app, and it was incredibly well received by my teammates at the time, who said, this is a revolutionary idea. Whereas to myself, I just thought, how is it in 2017 I can order a car at any moment, at any part of the city, get picked up by someone I don't know and get dropped off wherever I want to go. And yet I can't get access to a healthcare provider in any kind of timely or efficient way. I have to talk to somebody who's a recruiter who may or may not really understand what I need as the director of anesthesia. And there was little to no technology. In 2017, I was still receiving faxes of resumes from various staffing agencies when I needed supplemental staff. And when I was in business school, realized that when things are that distorted and behind and out of sync, right? Healthcare, for a host of reasons, is slower to adopt technology than a lot of other industries do. Because of that, I saw an opportunity and had written the paper. And as luck would have it, Cherie reached out to me after 19 years and said, you can help me with my startup. And when we met, she told me, I have this app that I've got a functional prototype, an MVP that I've been working on for almost a year. And then she had a deck explaining the value proposition, which was nearly identical to what I had been writing about, that there's a huge opportunity in healthcare staffing. If there's not enough utilization of technology, there's two sides of the marketplace. There's the clinicians who are dissatisfied with the process. There's certainly the clients, long-term care facilities, acute care facilities are dissatisfied, and there's an opportunity. And at that lightning bolt moment, I no longer was going to pursue moving up the ranks of hospital administration. I was the first investor in SnapNurse and put my money where my mouth is. And then eventually, we raised additional seed capital over the summer of 2017, and then I quit my job at Grady and have never looked back.
Wow. So we've got a lot to talk about. Number one is like a snapping app. Is that where the name came from, SnapNurse?
Well, that you can get a nurse in a snap. Yeah,
I like that.
That name came from Cherie, yes.
You guys are ahead of the curve, innovative within a healthcare industry. Why would you say healthcare is slow to adapt to new technology in general?
I think that's just a great question. I've been asking it most of my career. I think in 2010 at Grady, we implemented a electronic medical record, and we were behind a lot of industries, but the pushing, we were behind a lot of other hospitals, but the forcing function that the government used was that you were no longer going to get partial reimbursement for the implementation after October 31st, 2010. So what day did we implement it? October 31st, 2010, the actual last day of government funding, at which point there was a matching function from the government to do it. But I think part of it is, the nature of the care model. It's introducing anything that can disrupt care I think that generates a lot of fear from providers as well as administrators that, at that junction of care, even if it is all on paper at that time, that switchover is painful. And so they have to be forced to do it. And then it was incredibly painful. And I lived through that in my own department and throughout the hospital, transforming a large system like that. But then 3, 4, 6, 10 months later, no one would have wanted to go back. So I think all the benefits that you get after the fact, that you have these really clear records and the ability to search up and access to significant amounts of data at your fingertips, which helps drive improvements in care, that far outweighs the pain. But the hospitals at that time, many of them had to be forced into doing it with the loss of potential funding. And so I think that's part of it, is fear of change that could impact patient care in a real way. And then you have to put resources in place to ensure that doesn't happen. That's part of the reason why the adoption is slow.
Most of our audience is within skilled nursing facilities. How does SnapNurse assist skilled nursing facilities, and in what way?
Yeah, that's a good question. SnapNurse, fundamentally, we're a tech-enabled nurse staffing company. So that's to provide supplemental staffing. Part of it is we've used our technology to deliver staff in 24 to 48 hours. In traditional agencies, it's 10, 14 days, sometimes even longer. So a lot of it is, yes, we're providing supplemental staff, but the way we're using technology is significantly decreasing by a huge percentage that delivery time, where workers are sourced, vetted, credentialed, and delivered to the client in a much faster time frame. So that's a huge value proposition, right? But in a new company that is still getting traction, you've got to go out and sell and show them and prove the model. What happened in the last 12 months is that with COVID, we went through 10 years of business development in the last year, and what we were doing successfully went through a pressure test because everyone wanted staff in that way in the last year. And in many ways, we stepped up to a challenge, grew by 75,000%, grew the company, proved our technology has what the market needs and wants. And what happens next is, I think we've fundamentally changed what clients believe is possible, and they won't go back. They don't want to wait 10 or 14 days. Maybe their need goes away in 14 days and they don't need the staff. So that's first and foremost, that's our core business. But because we're using it through technology, I often say we're a technology company first and a staffing company second. Now we're talking to many of our skilled nursing facility clients about using our own software and becoming more than just a supplemental staffing agency that's got software that delivers staff quickly, is actually giving them access to our software, whether they white label it or we become sort of a blended software and staffing services partner, either helping them source from their own pool of candidates using our software, and when maybe their internal resources are exhausted, supplement with staff from our own agency. So that's where we see, and it's happening now, those conversations are occurring now as we come out of this very challenging last 12 months, is to just increase the offerings that we give to the clients.
That's amazing.
So at this juncture, we now have over 150,000 providers in the database. So the speed with which we can talk to our own staff is nearly instantaneous. If we get an order, we can do that. In addition, the ways in which we communicate to staff outside the platform, enabled by social media and other tools, essentially allows us to, if we didn't have those staff pre-credentialed in the database, we know how to find them in 24 to 48 hours and get them to the client.
I mean, recruiting is one of the largest industries. So you guys have this niche of recruiting, sort of a staffing agency for nurses in various departments. This is nationally?
It is. We are national, yes. A lot of that growth occurred in the last 12 to 14 months. We're not slowing down at all. we're now talking to all those clients and asking them, engaging them, use our software. We want to decrease your dependency on supplemental staffing. And the way for you to do that is for us to show you how we do it. So to further disrupt the industry by which supplemental staffing and recruiting occurs, so that they're not just dependent on us to do it, but we enable them to do it themselves and they become our software client.
What are some of the clinicians and clients dissatisfied with the original model?
For sure, at the very top of the list is speed of delivery, and then a close second, or sometimes depending on the client, equally important is the quality of the candidate. Right? If you deliver somebody really fast, but they're not high quality, and there's turnover or disruption or some event, then that doesn't help anybody. So it has to be the combination of quality candidates that are delivered in a very rapid fashion. That's not easy to do. And the way we've done it is to utilize, a platform that facilitates a lot of that in an automated way. The dissatisfaction is, I got a poor quality candidate, and then it's almost always delivered in a slower time frame. Then sometimes they get a quality candidate, but it took so long that the need changed, or they incurred a lot of overtime, or even had, risk events because they were understaffed for longer than they wanted to be.
Your company recently won an award, the Pacesetter Award in Atlanta.
We did.
First of all, congratulations, but tell me a little bit about that.
Yeah, so it was just last Friday, and we were in the Pacesetter Awards group. That means 100 companies in the city of Atlanta, some of them very large and established companies, a little older than we are, but many of them in the same neighborhood, 4 to 5 to 6 years old. The disproportionate between where we were in the second place is thousands of % difference. So it's remarkable. And of course, we're extremely grateful and honored to win that. It was also overwhelming because we're a 4-year-old company. The % growth is astronomical, almost unbelievable. It's wonderful to get the recognition and to think of the fact that we've been here in this city for over 20 years, and the Atlanta business community is relatively small. And we have friends and family invested in us from the beginning. We have very little outside venture capital, tiny amounts of venture capital. And we did take a significant investment from a family office in the fall of 2020, which has been wonderful and helped us get a significantly larger credit line. But it's our story, and that moment and honor is really a reflection of the fact that it's our friends and family who believed in us and our idea and our ability to execute on this. They share in that celebration as well. Most of them are here in Atlanta. So you can imagine it's exciting for us as a company and for Sri and I as executives, but it's overwhelming to be able to deliver that success back to early investors who believed in us personally and professionally, and have them share in that award as well.
Yeah, it's also amazing, especially during this time, this past year, the economy has been such a struggle. And to hear like a success story about how, 2 college buddies, they got over their phasing stage and they started a business together many years later. I mean, that's amazing to see that. Can you tell us a little bit about your secret sauce, or is that too much of a secret?
I'll say this, we have patents pending. I wouldn't want to say a whole lot more than what we're doing, other than I think the results speak for themselves, that it wasn't that we were refusing venture capital money. We did not have a great response from that, and turned back to friends and family several times. It's fun and satisfying to know that companies that come out of Silicon Valley and I guess get enough of a buzz that venture capital is, showering money, or at least giving money to those entities. It's hard outside of those environments to establish yourself as a tech-enabled staffing company or just technology company of any kind and raise money on that. One significant aspect of this story, which I haven't had a chance to tell, is early on in 2017, as we were assembling the technology team, we got introduced to Edwin Marcial. So that is another lightning bolt moment in the history of our company, where our lawyer, Josh Clayton, introduced us to Edwin as we were struggling a little bit with some of our tech hires. And Edwin Marcial, if you don't know who that is, he was the founding CTO of the Intercontinental Exchange, which was founded and still is here in Atlanta. They bought the New York Stock Exchange in 2010. And essentially the software engineers who built the fastest electronic trading platform in the world ended up being hired into SnapNurse and built the staffing platform that today is powered our growth and enabled all of what's happened. So it's not just Sri and I by any stretch of the imagination. We have a world-class technology team that has partnered with us every step of the way. Sure, we were talking to clients and knew from years of healthcare experience what needed to be created, but we're not engineers. But our team of engineers are extraordinarily talented. And Edwin, he had retired from the Intercontinental Exchange in 2014, and he was seeking Atlanta startups that he wanted to support and lent his significant expertise and skill. And essentially, he added a lot of staff for us who have an enormous trust and confidence in him. And they joined us, and they've been working with us ever since.
So tell me about some of the other initiatives you guys are working on. From what I understand, you're helping provide vaccines to needy in the Atlanta area?
Atlanta and nationally. So
Nationally?
as you've probably seen in the news and otherwise, we've certainly staffed testing sites and the mass vaccination sites, since the original vaccines were out in states around the country. And as vaccine hesitancy and just access and for the medically underserved, all that together has basically driven down attendance and it's dropping. And so a lot of those sites may close, but we're not there at all by any stretch of the imagination as a country. And the hardest hit are minorities and the underserved in general. And the best way to deliver the vaccine to them, and the demand at the moment, is for mobile vaccination units. As we do always, listening to the market, listening to the need, and assembling mobile vaccination teams and the resources required, which includes the mobile vans, as well as all the supplies and direct allocation from the states or the governments, to enable teams of 6 to 12 to travel in a van out to either remote locations. Some states, they're asking us to vaccinate the homebound, which we can only, between observation and the time for screening and the vaccination itself, you can only vaccinate so many people per day. So this is the hardest next part for the country as a whole. And, the nature of the way we source and rapidly recruit, and now essentially absorbing in the vans and supply chain logistics and expanding that operational aspect of our company, is we're taking on this next wave of vaccinations, which is mobile vaccines.
You have a different background, and you spent some time in Peru.
I did.
What was there? What was going on there?
Yeah, so my wife is an anesthesiologist at the Children's Hospital here in Atlanta. One of the surgeons there had asked to assemble a team that would include the operating room nurses, scrub techs, and of course, anesthesia. So my wife and I volunteered and went down there. I went for 3 years in a row. She's continued to go. Obviously, with COVID, they didn't get to go last year. As our company's taken off, I have not had the opportunity the last years, but I did volunteer with her for 3 years to go fly down to Peru and support them with providing anesthesia to do pediatric surgeries at a hospital that was constructed essentially in the jungles out of Moyobamba. It's an amazing facility by a Peruvian American cardiologist who grew up there and wanted to give back to the area. So it's healthcare. It's a special kind of work. And when you get the opportunity to go to another country where there's so few resources and provide something like surgery, which most of those residents just would never have access to in that country, that's an amazing experience.
So what would you say entrepreneurship is really like, and the future of work, getting funded, running low on funds?
Yeah, entrepreneurship is not for the faint-hearted. That's what I would say. I think both of us had backgrounds where we had been tested in many ways. I know the kind of work that Sri did in reality show television is as dramatic or as glamorous as it might sound, is also filled with deadlines and high pressure and uncertainty and fundraising, and then someone backing out, and then all of those challenges, which have a lot of parallels with running a company. For myself, I was just managing budgets, dealing with the bureaucracy and the nature of trauma, which is basically 24/7, 365. It never turns off. You've got to staff it all the time, but staffing is unpredictable. And so you're on call 24/7, 365 to ensure that the staff are where they need to be. So both of those have parallels, but nothing compares to the high risk undertaking of starting a company, raising money, then spending the money to build something that you believe someone else will use, knowing that you only have so much runway. And then when that runway runs out, everything comes to an end unless you have the revenue. It is both one of the most satisfying undertakings I think either one of us has ever done, but also the most terrifying. And whether you're small and you're managing a budget that has a short runway and you've got to go back out and fundraise, or you get larger, which happened to us over the last year, and then you have a credit partner where your accounts receivable build up so fast because you're growing so fast that then they can't fund you anymore and you're not going to be able to make payroll. The challenges come from all directions, and it's unrelenting. So I think the biggest takeaway is that when you choose this pathway, you need to be ready to give everything you have. And there's no turning it off once it starts either. There's no stepping off. There's sometimes not even a vacation for 10, 12, 18 months in periods of hyper growth for sure. So you just have to want it. You have to want it and be sure that you're ready to see it through to get to the level of success that allows things to stabilize.
Wow, I wish you guys a lot of success. I mean, it sounds like you guys are building a fantastic company, innovating in the healthcare space. So it's amazing what you guys are doing and doing it at a risk to yourself and your family, and people around you. So keep it up, and I wish you guys tons of success. And it's an honor to meet you and have you on the SNF Spotlight Series.
Excellent. Thanks. It was such a pleasure to meet you. It's an honor for me to be here. Thank you.
Thank you for sharing this tremendously important part of senior care. The SNF Spotlight Series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.